All right, can you see my screen, Gus?
I can, yes.
All right.
The broadcast is now starting. All attendees are in listen-only mode.
All right, I guess welcome everyone. We're just going to wait a few minutes before we start and give time to a few more attendees to join. All right, guys, we'll just give a couple more minutes and we can begin. All right, I guess that's enough. I don't know how many more people will be attending, but okay, to begin, I'm just going to go over GoToWebinar settings before we start. On the upper right-hand corner, you have this orange hide and show control panel. Feel free to show the control panel and lower your gaze towards the bottom of that panel. There's a question section. Type in any questions and we'll try to address these questions towards the end of this joint webinar. And if we can't attend to your questions during this webinar, we will be sure to send you an email pertaining a response to that question. Well, I guess to begin, I will introduce myself. My name is Praveen Kanda. I'm the Director of Intellectual Property and Innovation for MTBC. I've been working at MTBC for about a year now. My job entails me to talk to providers and hear their suggestions on ways to improve their practice concerning their billing and practice management elements of their practice. I am joined by Gus Salvoff, who will spend a few minutes explaining his role. Gus?
Hi. First, thanks for having me. My name is Gus Savloff. I'm Vice President of Sales for IMD EMR Healthcare Systems. I've been with IMD EMR since its inception. We are going on 4 years commercially in the market, over 450 users using our system. And I also kind of travel around and talk to our users and see kind of what's going on in some of their needs, so that we can make sure that we keep, the software basically relative to what's going on. So that's basically my role in this company.
All right. And okay, so I guess thanks for that introduction, Gus, by the way. And I guess today we'll talk about the top 7 ways to improve your ophthalmology practice. And as you guys probably see from the slide, this is a joint webinar by IMD and MTBC. So I guess to begin, a common idiom that I hear providers tell me is that their time is money, and I can't agree with them more, because the more time they spend on patients and their care equals more money and revenue for their practice. So typically when they come to me, they ask me to provide suggestions on ways to improve their practice management and billing management cycle. And most providers come to me and tell me that a few common complaints they hear from patients is, 1, the wait times are too long. 2, they're having a very hard time scheduling. And 3, usually they're not very informed about what's going on with their medical care. Typically, most of these solutions are solved by maintaining a robust EHR and a very efficient practice management and revenue management cycle. One of the main methods I tell providers to improve their practice is by improving their schedule. And their scheduling is a major part of their practice, because if you can improve their scheduling, then you can prevent future problems from occurring. And ways to improve their scheduling there are multiple ways. One way can be simply keeping the patients more updated and informed, letting patients see the provider's schedule on a day-to-day basis, and just keeping the practice communicating in a more efficient manner. Mostly providers come to me and say, what's the best way of keeping patients informed? Well, I would say the best way to keep patients informed is by maintaining a website or with the online PHR and possibly a scheduler option. This way, your patients can see your scheduler, can track your days off and your holidays, and basically keep up to date about your schedule and can coordinate their schedule accordingly. Another way I usually recommend providers to keep their patients informed is by maintaining an automated reminder call system or automated reminder system. And this is done by either phone, SMS, or email. And in this method, what happens is a patient that schedules an appointment can be informed about his appointment a week before or a couple days before, asking him either to confirm, reschedule, or possibly cancel that appointment. And interestingly, about 20% of patients that a provider sees cancel their appointment, which allowed the provider to reschedule another patient in for that time and hence increase his revenue. So we typically tell providers keeping the patients more informed usually tends to automatically increase your revenue because they can schedule appointments when they're available, and you can also cancel appointments and schedule in other patients at that time. Another thing that I usually ask providers is if they maintain communications with the front office or the front desk receptionist and them in a more efficient manner, it generally tends to streamline their daily workflow. And increasing their daily workflow has the office running in a faster and rolling system, so it makes the practice run more smoothly. And one of the benefits of having a robust scheduler would allow you to put in patient and doctor notes so that the doctor can inform the front desk when to schedule a follow-up visit. And this follow-up visit can be anywhere from 2 to 3 weeks, and the front desk receptionist would be able to coordinate accordingly. The second thing, oh, go ahead, Gus. No, go ahead.
Question on the confirmations, the telephone and the email confirmations. Have you noticed in the people that you've implemented this a drastic drop in no-shows when these methods are implemented?
Yes, that's absolutely correct, and many providers are very impressed by that system. And once they realize the increase, or the decrease, I should say, in no-shows, then they would usually they would have time to schedule another patient, and they would tell us about how many no-shows they get in a day and how they can reschedule another patient. If someone calls in for a walk-in, they will always have the time now with the decrease in amount of no-shows. And this is all a cycle. So once you figure out your scheduler, it prevents a snowball effect, and you can actually figure out how to schedule patients in and increase your revenue. So many patients are very impressed by that feature and actually tell me ways to improve that feature and improve on what we have currently.
Excellent.
All right. And yeah, the second thing that doctors usually bring up to my attention is verification. A lot of providers talk to me about how long their front desk and themselves have to spend talking to insurance customer support and just checking up on eligibilities from insurance companies. And one of the methods I tell providers is if you streamline your verification and automate it, then most of these timing issues and spending 3 hours in a practice just checking up on eligibility will be eliminated. And one of the impressive things about our system would be that once you have an automated eligibility verification system, you're allowed to check on the patient's eligibility automatically, and hence you would be able to tell the patient before his arrival whether he's eligible for that appointment, and hence tell the patient basically to renew his insurance or figure out with his insurance provider where the mistake occurred. So by the time he shows up at your front door, he would be already accounted for. This also is another snowball, to prevent another snowball effect. If a patient comes to your door and you do attend to him, typically that appointment would not be covered by the insurance, and that is generally one of the biggest problems with billing, where their insurance is not eligible for that appointment because the insurance date ran out right a few days before that appointment. And I guess, Gus, you have any questions concerning?
Yeah, actually, great value to what you say on the automated eligibility verification. My question to you is, from a billing perspective, by being able to do the eligibility ahead of time and being able to catch potential pitfalls of maybe somebody just didn't give the new insurance information to the practice on time, do you find that when you do this, the billing cycle and the billers spend less effort chasing insurance and are able to focus more on the actual collections of the claim?
Yes, and yeah, most of our billers, when they when they get a claim that has no insurance verification because they're not onto our practice management cycle, then they usually bring it up with the provider, and it just elongates the whole process of communicating to the insurance. And a claim usually, which takes like a month or two to get payment from, it gets elongated to 6 months or more, and now you're arguing and bringing in appeals and fighting back on that claim just because the patient wasn't eligible for that week because he forgot to renew his insurance eligibility. And it was simply just a gaffe, but it takes that long. So,
Yep.
And I guess another thing I usually tell providers is, whether it's an online or electronic system, I tell them to maintain their cash flow in a computerized format, which will actually streamline their daily revenue. And this is shown in everyday affair. If you look at TurboTax and many other industries, they're all going electronic, which makes more sense for providers to do the same. If you go electronic, you can start tracking your daily revenue, tracking exactly what receipts you're giving out, which patients have IOUs, which patients give checks as opposed to cash, and you can follow it in a more long-term manner rather than having all this paperwork, storing this paperwork for 7 years according to HIPAA regulations, and maintaining all this. And for instance, if something goes lost, then you're in trouble. So I usually tell providers, if they maintain a robust online system, then they can track better than most providers, and rather than always run back to the office and look through bills or have an accountant to sort through the whole thing, they have their whole system online or on their computer, and they can actually track that. In addition, I also would like to mention that having an online cash register really helps you generating income reports, which can add a totally unique element to your practice, because now that you know where your income is coming from, either in a monthly or a yearly fashion, you know what are your target group in terms of marketing, in terms of sales, and you can actually tailor to that group around you based on your income. Because once you know the provider's birth date and age, and you know what providers generally come through the door, you can target your marketing or your sales towards those patients, telling them about how much these patients come in and what services you provide. So, Gus, any questions regarding her?
Yeah, on the weekly, monthly, and yearly reports, in ophthalmology, there's some ancillary type procedures that ophthalmologists sometimes do that are not covered by insurance, certain surgeries, things of that nature. On these reports, I assume it would be very easy to allocate each one of those services so an ophthalmologist can look at his practice and say, okay, this is how many surgeries I'm doing that are cash, this is how many of these procedures I'm doing so they can kind of identify some of the profit centers that they can capitalize on.
Yes, exactly. And that's what I said. That's why these income reports are so crucial. If you figure out you're doing one procedure more than the other, then you know to tailor your promotions to that procedure, saying that you're leading in that industry and you're providing support for everyone around your area, and more people will come just reading that promotion. So, I mean, this is literally almost an ancillary benefit to having an online cash register. I mean, something you would think the whole industry would be moving towards because everything's going electronic now. But now providers are realizing this secondary benefit and saying, hey, I can do this now, I can do this, and I can actually track everything, so I know where I have to focus on, improve their practice that way. All right.
Excellent.
And, okay, one of the final things I usually tell most of our providers is by automating billing submissions, you save so much time and so much money that you don't need to hire a separate individual just to manage your billing management. And that really alleviates a lot of providers' concerns regarding billing, because many providers just simply want to submit these claims or submit the CPTs and ICD codes and expect the bill to submit the claim appropriately. And what I tell providers is one of the unique things about MTBC is once you join, we start creating rules based on your practice, based on procedures you tend to do on a daily basis. So the rules will be defined by your daily practice, and we can tailor these rules specifically for your practice. Currently, we have over 800,000 rules, and we're growing based on each practice we attain, and we provide more rules to our system that attain to ophthalmology. In addition, we actually have a group of attorneys to monitor denials and underpayments and actually file appeals on your behalf when you request it. Now, this team is pretty much dedicated to your practice, so based on your response, we will file accordingly. In addition, we also have a dedicated billing team that will track your daily submissions and try to reduce your denials by keeping you informed about what the insurance requests. This request could be anything from you forgot to put in the patient's date of birth in the EHR to something as simple as you forgot to put in the patient's last name. And the billing team would notify that before we submit the claim. Hence, you would be able to contact us and send in that reply or that informational request and keep us up to date on how to submit this claim. And most providers find that using these two in tandem, an automated system and a dedicated billing team, solves most of their problems. And the more you use the system, the more acclimated we get to what rules we have to put into the system, and the better off your practice is in the long run. And as there are changes being made, we can also keep you updated into those changes. Any questions, Gus?
You know, one question that I have on this, which I've seen in the past, is, you know, physician practices get really busy doing the day's work, you know, seeing patients, trying to make sure the paperwork is in place, and all the administrative type of burdens that come with them. Do you find that when somebody goes on the MTBC system, because MTBC adds that layer of professionalism that you guys focus on finding the rules, on the dedicated billing, and on you know, making sure that, you know, the practice is kept up to date on all the new billing requirements that could come out, do you find that the practice has more efficiently dedicated themselves to the day-to-day work without having to worry about some of this back-end stuff?
Yeah, and most practices usually tend to tell us that during the initial few months they actually spend the same time that they did previously, but as they get more acclimated to our billing, then they tell me about the significant reduction in time that they spend on billing, and it's simply just circling those CPT codes and ICD codes and pressing one button to scan it to us. And literally, they do all these procedures and diagnosis. By the end of the day, they give it to their front desk, and their front desk just puts it into the scanner and clicks one button. That one button does so much, gets to our billing submissions team. They handle it. They look at everything. They know exactly what you're talking about based on your instructions. Then they run it through our rules-based system to make sure you did put in your, the patient's birth date or patient's last name. And then they check it again based on previous rejections with similar claims, and then they get back to you. And they notify you about those discrepancies, and the provider basically updates us and keeps us informed. And hence, after some time, their revenue cycle shows a significant improvement, and they actually see an increase in their billing. And we've actually been told from our ophthalmology practice that we have a 95% first-time pass rate, which basically means that the provider is telling us that every time he submits a claim, there's a 95% chance that the claim will go through. And the industry's average is only 90%. So we consider for ophthalmology, we're significantly higher than that. And we're actually building more rules tailored for ophthalmology with our currently robust system. And we're just improving on the system in the whole. So most providers provide us fairly good suggestions on that. And I guess the next one we'll talk about IMD's EHR. Hey, Gus?
Well, thank you. So the importance of an EHR EMR, specifically as we see it in ophthalmology, is there's many benefits to it, but some of the important things are having a system that presents clinical data to the ophthalmologist for quick and easy review. We find that when we are able to display a summary of a visit to a physician with highlighted areas of problem areas, it really creates an efficiency for the practice. Ophthalmologists do a lot of diagnostic type testing, and so when we can present those findings in a method that lets them focus on the problem areas and not have to sift through a bunch of normals, there is a great benefit to the practice for the physician and the tech to being able to do that.
All right. I guess one of my questions were with these ophthalmologists doing a lot more procedures. Do you feel that an EHR takes away or adds to the patient-ophthalmologist relationship in terms of how much time he spends on the EHR? I'm assuming in IMD's EHR, he spends a lot less time dealing with the EHR and spends more time dealing with each patient.
So to answer that question is, what we see is, because we create an efficiency where things flow in a very consistent manner and have a very smooth ophthalmology flow, because that's all we focus on, we see that the doctor is able to move through a visit in a very robust way, where they can, in a lot of cases, speed up some of the things that they do, hence allowing them to spend more time with the patient, specifically when they're reviewing images and diagnostics. Because the diagnostics get pushed straight into the patient chart, the doctor can comment on it or even review it with the patient in the room. I have a client up in Nashville. What they do is they actually have an extra monitor in the room where the diagnostics come up, and as the doctor is documenting, he can review the study with the patient, explain to them, what the findings are. So we see that there is a great efficiency to being able to do that.
Oh, okay. And share the next one. Next slide.
One of the nice things about an EMR, and a lot of EMRs have this, IMD EMR has this as well, of course, are predefined treatment plans, or what we call fast plans. And we find that ophthalmology practices, in a lot of cases, kind of create a little specialty niche for themselves, or they're in an area where they're seeing some of the same patients over and over and over. Maybe a lot of them are seeing a lot more diabetics or what have you. the predefined treatment plans are there so that the doctor can go straight to what the plan is, what they say over and over and over, change it so that it is relevant to that patient's visit and whatever the prescription is going to be for that day. And again, be able to spend more time with the patient and less time documenting, because most physicians already know what they're going to say before they see that patient. If it's a repeat patient, they get to know the patient. So by having a predefined treatment plan, it really accelerates the process of documenting, where we can create good documentation, but give the doctor the opportunity to spend a little bit more time with the patient if they had to.
So with the predefined treatment plans, are they tailored towards the actual procedure or towards each patient?
Well, they're normally diagnosis-based, and so I'll give you an example in IMD. If somebody is diagnosed with a particular code, blepharitis or whatever, plans related to that have been predefined by the practice or by the doctor are going to show, and the doctor is going to be able to choose the plan that is most relevant to that particular visit. It's not a one-size-fits-all. Sometimes there's a couple plans for the same diagnosis, but it gives the doctor the ability to very quickly say, okay, I want to treat the patient this way today, and push that predefined treatment plan into the patient's chart, and give the orders and create a pathway to whatever treatment the doctor sees fit.
All right. And I also read here about the ERX process.
Yeah, and again, ERX has kind of been pushed a little bit longer than the push for EMR, and the process of ERX becomes extremely efficient when it's done right. When you can push a prescription into the ERX system and send it out with very little effort, do it between plans. Interestingly enough, we have a physician by the name of Dr. Arnie Stein out of New York, and he actually wrote a response to an op-ed in the Wall Street Journal, particularly describing his experience with ERX and how efficient it is when he can just go ahead, click a couple buttons, send the prescription in, the patient knows it's in the pharmacy, it checks for contraindications and allergies and things of that nature, which really takes a lot of the burden off of the physician when they have to do it manually. So some of the benefits to ERX is more than just a prescription. It's some of the checks and balances that go along with it that can ease some of the burdens on the practice themselves.
All right. And did you find that most providers that don't use any electronic methods actually improve their practice significantly within ERX, because patients are just they just get their prescription so much faster when deals with anything ophthalmology related?
Yeah, well, there's something to be said about a doctor having a prescription pad, writing a prescription, and handing it to the patient. Where we see the efficiency in the ERX side is, number one, here's a couple things that we've seen that have made it more efficient. The patient never comes back and says, I lost my prescription. The prescription is sent to the pharmacy, the patient goes to the pharmacy. They don't leave the prescription in a notebook, they don't drop it in down a sinkhole or whatever. Number two, there is what I said before, the checks and balances, which I think is very important when the doctor has that peace of mind that formularies are being checked. So insurance-based prescribing, the doctor is not going to write a prescription and then the patient's going to come back and say, hey, doctor, you got to change it because my insurance doesn't cover it. So there's a lot of these checks and balances that actually create a long-term efficiency, which we found a lot of the practices that we work with really love once they come to terms with the benefits.
Oh, okay. Okay.
Going back to the discussion of billing and documenting within the EMR, one of the nice things about the EMR process is when the doctor is done documenting, things that EMRs do that sometimes don't happen on paper is they prompt the doctor based on their preset plans and things of that nature to really document robustly, and a lot of times being able to charge more accurately. I'm not going to say upcharge, but more accurately, things that sometimes are left behind on paper, and we see a lot of that. But one of the nice things about it is capturing the highest level of reimbursement by using the EMR, because the EMR itself is programmed to drive the visit. So we do see that there is a potential for higher reimbursement without the fear of extensive audits because the documentation is already there.
Yeah. I remember reading an article that said most providers that switch onto a EMR increase their their higher reimbursement rate by like 40 or 50% because they're just not charging the same for procedures they typically do that they didn't know about.
Yeah, interestingly enough, I read that article as well, and one of the interesting things about it is that originally, you know, with the EMR was really one of the driving forces behind EMR is to lower the cost of healthcare. What they're finding is that there is a temporary increase because people are documenting more and therefore being reimbursed more. Where is that going to take us? That's probably another seminar that we need to do. But that being said, we are seeing the benefits of, you know, the government insurance carriers have all said that they want better documentation. Well, EMR provides that, and the result of that is better reimbursement for the provider. So hopefully that kind of relationship becomes a positive one and allows the physicians to get basically rewarded for documenting better. And we see a lot of that. We do see much better documentation.
Oh, okay.
One of the other things that I personally feel EMR brings to the table that is so absolutely efficient is pass-through billing. You know, we talk about circling super bills and things of that nature, but what happens is when you do that, a lot of times there's a manual process that goes along with entering those charges into a practice management system. But when you have an EMR that is driving the documentation, using IMD EMR as an example, we have a robust cross-coder and some original filters in there that will create a very accurate billing sheet that gets automatically passed into the PM where it's already posted to the patient chart, and all the biller has to do is review it for accuracy, probably give it another look for you know, any other edits and things of that nature, but then the claim can be sent right away. So we see an increase in the time that a claim gets entered into the PM, and we absolutely see a value in the accuracy of the claims. Yeah. And just to add to MTBC being at a 95% reimbursement rate for ophthalmology, which is phenomenal, this could be another layer to maintain that sort of success rate.
And I remember talking to you earlier, and you said we have, with this pass-through billing, we also, it's more like a double check, where we check once with your pass-through billing and then once again with our billers. So it's basically a system where they're more secure and their claims are reviewed twice prior to actually getting processed with the insurance company, correct?
Absolutely, and that's one of the nice things about this, because, you know, in this particular case, the doctor gets the best of both breeds. You know, anybody, you know, such as ourselves or anybody else who's ophthalmology specific is going to understand the ophthalmology space to a level that is going to benefit the provider. And then when that information gets put through to another system which understands the industry just as well and understands the rules that are built and things of that nature, you know, the end result should be a very, very high reimbursement rate.
Yeah. And I guess those are the top 7 ways. And I guess one of the things that most of the people that joined the webinar would like to know, I guess, would be a little more information about IMD's EMR and how it would help ophthalmology practices. So if you can go into a little bit more about IMD and, you know, tell us more about the company, that'd be great.
Sure. So real quick, because the reality of it is I can talk about IMD EMR for hours because I'm so passionate about what we do, so I'm going to keep it very, very short. the reality is that what we bring to the table is, number one, an absolute fundamental understanding of the ophthalmology space. And because we have that understanding, we understand the way the practice works and what the needs are. So what we deploy is ophthalmology EHR EMR solution, which puts to the side a lot of the bells and whistles and gives the physician pure functionality, pure understanding. We understand how to interface every piece of equipment into our system. We do not charge for interfacing, by the way. It is included with our product. And what we deliver is a system. If I can summarize our company, is a system that will work for a one-physician practice or a 100-physician practice. We have the spectrum. We're an enterprise-level system without the enterprise-level cost. So what happens is, one of the nice things about IMD is, if you're a one doctor practice and you're looking to grow, you go with IMD. You never have to worry about changing your EMR. And if you're a large practice, you can continue to grow and you don't have to worry about it either. So scalability, functionality, and an understanding of the ophthalmology space is what IMD EMR really brings to the table. And I urge anybody who is at least intrigued by what I'm saying to contact me and let me schedule them for a demo. And I'll be more than happy to kind of show exactly what it is that I'm talking about.
And I guess I'll provide a little information about MTBC for IMD clients. And basically, MTBC has been in the billing and revenue management cycle industry for more than 10 years now. And we've actually excelled at providing dedicated teams to handle both their billing and having an automated system that handles their revenue management. In my experience talking to front office staff and providers, one of our most frequent compliments is that our system is much easier to use by the front desk receptionist, and they generally tell me that the system is so easy that generally learning the system takes a lot less time, and we usually only provide a training on over the phone, and that training is more than sufficient to get their front receptionist up and running using our billing and revenue management site, as well as our practice management site. Since our practice management site is mostly dealing with the scheduler, most of our providers and front receptionists had just talk about ways of improving the scheduler, and we usually have a IT department that's very robust that we can actually address some of their suggestions and provide updates for our clients and keep them up to the loop and get them involved with their own practice management site. We also provide PHRs for practices in terms of improving their patient relations with their practice, and provide websites for providers to showcase more information about their practice and their services to their patients. Finally, as I mentioned, our billing and revenue management cycle is basically our cream of the crop. We actually have a dedicated team. We also have automated billing submissions where we can actually factor in rules and measure your billing. And this is usually used by multiple practices, but we have a very big vendor in NYEE Ophthalmology in New York. And so far, they've been very satisfied with our service and very impressed that their billing right now is at 95%, as Gus mentioned, which is way above the industry standard. So they're very impressed with that. And yeah, similarly as Gus said, to find out more information about MTBC, we recommend that you either call the number on this slide or also send an email to info@mtbc.com, and you can always visit our webpage at www.mtbc.com. And if you give me a minute here, I'll try to see. Okay, so I don't see any questions on this chat, but yeah, if you have any questions and concerns, please feel free to just text or email info@mtbc.com, and we'll just try to respond in kind. Is there anything else you'd like to add, Gus?
No, I just want to thank you for the opportunity, and everybody who attended. I just want to thank them for taking the time to get this information.
Yeah, and same thing with me. Thanks everyone for attending, and I hope it was educational and you learned on methods to improve your practice and your ophthalmology practice. And feel free to call either IMD or Gus or me for more information concerning this webinar or these companies. Thank you.
Great. Thank you.